Welcome to the Clinical Leadership and Professional Relationships Unit. My name is Leonie Pike and I'm the Unit Coordinator. I come to this unit with 30 years experience as a registered nurse in a variety of leadership positions, including working as a clinical nurse consultant, a nurse unit manager and a nurse manager. I've worked in multidisciplinary teams and I've enjoyed really successful professional relationships working with midwives. Having worked with groups of people for all those years, I wish I'd studied leadership when I was beginning my career. It's wonderful that you have the opportunity to do so in this unit. This is a theoretical unit that has clear practical implications for all nurses and midwives. Nurses and midwives work with others in groups, in large health systems, in professional groups, and in multidisciplinary healthcare teams. The quality of both high-level health system leadership and leadership of smaller groups and the professional relationships within those groups have major implications for healthcare policy and individual patient outcomes. The unit consists of 8 modules exploring foundations and innovative approaches to leadership, and also working with other professionals in the clinical context. The first module is an introduction to leadership and professional relationships. Then the unit reviews leadership styles, culture and conflict are explored, leadership in the context of quality improvement is examined, the importance of emotional intelligence is discussed, leadership and teaching as an integral part of the health system is reviewed, and then leadership of teams and the importance of professional relationships is demonstrated. There are 3 assessment items. The first assessment item includes 6 online activities, and the 4 best scores from those 6 items will be included in the final mark. There is a scenario-based essay. Then there is a group presentation and an individual associated reflection. One of the big questions of this unit is, what is leadership? Is it getting people to do things? Is it about achieving goals? Is it about bringing people together, or is it about helping develop others? Is it about taking responsibility and making decisions and sometimes taking risks? Maybe it's about all of those things, and maybe it means something different in different circumstances. An important issue to think about for anyone when beginning in any workplace is the type of leadership that might be present. In my experience of work, the style of leadership of the organisation can mean the difference between doing a mediocre job or a great job. It can mean the difference between staff flourishing or stagnating, and it can have a very strong effect on the culture of the workplace. In the healthcare system, care is mostly provided by teams of people working together, so how the team is led is very important. This may be even more obvious in nursing and midwifery. Leadership is a fundamental element of achieving optimal outcomes for the person receiving the care. So ask yourself, is leadership important to you as a nurse or a midwife? Many of you might soon be new graduate nurses or midwives. You will not necessarily be senior in the hierarchy of the health system, so you may not see yourself as a leader. But you will be working as a leader when providing care for people, either as a nurse or a midwife. Though we work in partnership with those we care for and the approach aims to be woman or person-centred, there will be times when the nurse or the midwife takes a leadership role. As a nurse or a midwife who ascribes to evidence-based care, you may be demonstrating leadership when presenting some evidence to the healthcare team and thus taking a clinical leadership role. As soon as you gain a little bit of experience, you may soon be the team leader, coordinating and leading a shift, or even leading a multidisciplinary team when you're coordinating an individual's care. You'll soon be a leader in some way, and it is important to reflect on how you lead and the style that suits you and the situation you are in. In Module 1, there's an exercise. It's not definitive or validated, but it's a bit like a personal quiz that may provide you with some food for thought around what might be important to you when you're in a leadership position. The style of leadership is a major characteristic of any system. The healthcare system in Australia is very large, and it's important to reflect on the health system and its leadership at a macro level, and there might be opportunities to do that at a postgraduate level. In this unit, though, we are mostly focusing on styles of leadership in smaller teams and the effect on outcomes for patients at the point of care. I encourage you to engage with this unit. I wish I'd reflected on these ideas at the beginning of my work as a nurse. It might have helped me achieve much more for myself, but more importantly, better outcomes for those I was caring for. So, engage with the learning materials. There will not necessarily be a PowerPoint lecture for every module. Actively read the assigned articles, which means making notes as you go, and attend to the online activities. Engage with and be active in the tutorials. Submit the scenario essay and start working on the group presentation early. You will need to work on the presentation in your own time, though some time will be given in tutorials to prepare the presentations. Leadership and professional relationships is relevant to all of us. This unit is relevant to all of us working in healthcare. I wish you all the very best studying this unit, clinical leadership and professional relationships.